Welcome, everyone, to our conversation series. We are so glad you could join us today to discuss this important topic of coalition. At a surface level, I can imagine that it seems like these speakers have very little in common. Leisha's based in the US, Last Mile Health's work is strong programs in Africa. Asif lives in India, leads Jan Sahas's work across many states in India. Leisha has been focusing on strengthening public health response by really investing in community health systems. And Asif has been dedicated to elevating the voices and rights of the most marginalized groups in India and the invisible labor force, really, women in manual scavenging, migrant workers. But actually, at a deeper level, they have so much in common that we're going to learn from today. Their organizations really value deep partnerships, not to increase the footprint of their organizations, but to truly scale the mission and purpose and to solve at the scale of the problem. So I want to start with something you both mentioned of how important it is to work with government systems, right? And I really want to ask you to speak to that and what you also mean by a system, how often that comes up.
So in Liberia, and really in very close partnership with the government of Liberia and the Ministry of Health, we really began our work focused on direct service delivery via community health workers. And I think in my mind's eye, a lot of this, when we're dealing with deeply intersectional and complex societal maladies, what that meant for Last Mile in Liberia was specifically a recognition that there is a patient out there that lacks access to care. And our aim is to remedy that and to make sure that they have quality, dignified services by a trained, professionalized, reputable provider. And what we initially got really good at was the deployment and the support and the professionalization vis-a-vis direct services of community health workers. And that was undertaken in conjunction with the Ministry of Health. What we really quickly learned is that that is inadequate. Those health workers clearly need to be integrated into the broader health system, and particularly for folks that are living in remote rural regions and that have historically been systemically excluded. The public sector really is the market that is going to be the one that identifies them as constituents and is obligated to provide care. So we got good at integration and health system strengthening. And I think then the next step was really related to this recognition that you do in fact need an enabling policy environment to be able to institutionalize and curate change, particularly if we're looking to support the level of government ownership and ambition that I think we were seeing with key allies within the Ministry of Health. And then sort of the final element there that I think we're now starting to lean into is the recognition that financing needs to flow in a way that is not an obstacle to the downstream effectiveness, be it of policy or health system strengthening or direct delivery of care. Though I think for us, a lot of this has really been with the singular focus that each of those activities falls with a commitment to that patient out there receiving care and seeing how we can ensure that the providers that are going to provide that care are not obstructed in their work, but are actually enabled.
In one of your articles, you opened with this really powerful statement. Given how large our country is, there are only two types of people who can work at creating change at scale: the communities that are facing the issues firsthand and the government. So tell us now what you mean by that, and how does this actually come together in the work Jan Sahas is doing?
So there are 773 districts in India. And however, most of the organizations, including us and many others, working in few districts. And I strongly believe that in this kind of like the country or like the geography, no any single organization or multi-organization can implement the large scale programs. So in that context, we strongly believe that the community that are facing the issue firsthand or the government can like implement the large scale program and change the situation. And the not-for-profit organization can play the role at some level. And apart from scale, also focusing on depth of the intervention. Because most of the time nowadays in the philanthropic sector or like the not-for-profits, everybody is discussing about the scale. And I think definitely scale is very important, but depth is also very important. And I think we need to focus on both the things like scale as well as the depth. And not only at the implementation level, but how we can ensure the community participation and agency at the design level. So I think that kind of role not-for-profit organization or civil society organization can definitely play. But implementation of the large-scale program is responsibility of state, and we can provide all like facilitation support from the philanthropy side or from the not-for-profit organization side.
And Lisha, I want to come back to you on this, right? For what you were saying, you also had this shift from direct service delivery to recognizing, but it isn't this one-time thing. It isn't, I've done a pilot, I've shown it works, we've shown evidence, now the government is scaling, right? It's a bit of an ongoing engagement. And can you speak to what that really means of ongoing and how that's been evolving as well?
I think for us around the arena of health, and this might be somewhat contextually different in different country contexts, we've actually seen that there's been significant appetite by our ministry partners around innovation. And I think something that we felt an obligation around is to not sort of go and do separate standalone components of innovation or piloting, but actually to engage from the get-go allies within ministries around what their vision is and where they actually are seeing that reform could be fundamentally beneficial in our instance to the patients that they're committed to serving, and actually jointly design the way in which we could do things differently. Given the really exceptional work that's coming about through the Gender Fund, is actually some of the areas in which I think not-for-profit allies are able to help identify solutions or even the right questions to ask in concert with government partners. And that's been a partnership. It's not been something where, like, I think there's been an absence of interest by the government. I think frequently we've kind of shifted from a moment, at least within the arena of community health, where people were asking, like, why does this matter? And now they're asking how. And I think what I see as our role as an NGO is to undertake activities to be able to answer that question of how, and to share that, I think, both with other implementing partners, with policymakers, with those that are funding this work, and also with the governments that are ultimately going to be responsible for preserving and maintaining these services over generations.
At Co-Impact, we have a very simple way of saying this sometimes, which is, who else wakes up and cares about this, right? So it's an organization asking, I want to solve this problem at the scale of the problem. Who else is going to wake up and care about this? And who else needs to really be involved so that this issue is solved at that scale? I'm going to start with Asif, because Asif, in this effective social security system for migrant workers, you definitely are working with government and communities, and great examples there. And you've managed to bring in this active participation of the private sector actors, right? So tell us about why private sector, and how are you actually bringing them in?
We need to think about three systems. And in India, we say Samaj, Sarkar and Bazaar, like society, government and market. And basically, we discuss a lot about the system of government. But in India, most of the migrant workers come from the social excluded communities, such as scheduled caste and scheduled tribe community, like the Dalit and Adivasi community. And at some level, they are facing lots of challenges in the rural area because of the social systems. So they're forced to migrate from rural to urban because they want to reduce the untouchability or discrimination in the rural area, or basically they want to change their social status. So I think in that case, we need to work at the social system level, and we need to work at the government system level, but also the market is also play a very important role, and different kind of systems exist within the market also. So basically we try to engage with the private sector. It's not a responsibility of the philanthropy or not-for-profit organization or government to support the migrant community, because you are getting lots of benefit from the migrant community. They are providing all the workforce support, but you are not providing required support to the migrants. So we engage with some companies just after the pandemic, and we signed up. These companies signed a pledge. In the next 3 to 5 years, we try our best to provide all the required support to the migrant community. Definitely, it's very difficult because sometimes issues related to minimum wage is very big, and the political issue, for example. So some companies are not very much interested to discuss these kind of issues, but we basically identify some non-negotiables where we are not agree with any company. For example, like the sexual harassment at workplace is a non-negotiable, or low wages for the women worker is non-negotiable. Child labor is a non-negotiable. So basically we identify these areas where Basically, we will not compromise, but we also identify some areas where the companies are very much interested to work.
To give people example of how broad coalitions can be, right? Last Mile Health, as you talked about, this advocacy for, I think, getting community health workers on salaries, recognizing it as a very, very important, I think, infrastructure of getting services to those who are left behind. There are global coalitions, right? And then the global resources that need to be directed. So tell us an example of how Last Mile Health is thinking of a coalition even beyond a country level to actually make some of this happen.
If what we're driving towards is fundamentally the realization that there need to be more exemplar community health systems, and Last Mile Health and other actors' roles are to accompany country governments on a progression pathway of ensuring that country governments are actually supporting community health systems that have community health workers operating at a national scale, where there is integration in data and financing components of those community health workers into the broader system, where community health workers are skilled, salaried, supervised, and supplied. That is sort of the central feature. And I think that what we're then also seeing is that needs to be directly tethered to downstream improvements in community health outcomes. And then upstream, and where this actually really looks into something that's beyond sort of the national unit orientation and more global, I think we see is really related to how policy is articulated, what global norming bodies indicate is sort of the norm and what is acceptable, and then also how financing is reformed. I think we're seeing the potency of joint ventures for reform around fiscal modifications that really enable those exemplar community health systems.
If there was one key message, right, about coalitions, about this conversation we've had that you want your audience to know, what would that be? And Lisha, I'm going to start with you since we just talked with where you were going with some of that inner, and then I'll hand over to Asif before wrapping up.
As relates to coalition, I would just reinforce this work is hard and we can't do it alone. And there is enough work to do that sort of finding those that share a vision and a fire in their belly for the elements of equity that I think whether you're working on issues of climate or ag or security or education or health, find your tribe and figure out how to work with them in a way that is not replicating activities, but that's actually mutually reinforcing. And then I would say just writ large in terms of for this community to step away. I am very much thinking about how in a few weeks, I and many of us are actually going to converge in New York City for the UN General Assembly. And I think that at that gathering, the world's eyes are very much going to be on, very appropriately, the conflict in Ukraine and climate and energy independence and the myriad of maladies that we are being challenged by and are being called to address. And I think that it is my bias and it is in my mind's eye that we are not going to be able to make meaningful progress in solving for many of these societal ills if 2 billion people globally are systemically disenfranchised because they lack access to basic care.
Asif, last few words from your side.
If we want to work as coalition, I think we should focus on scaling up of the mission, not the organization. Because sometimes like the philanthropy also want to scale the work of one organization, but not their mission. And basically these two things are very different. And I think if we want to scale the mission, in that case, we need to engage with multiple organizations. And that approach is very sustainable because one organization will not take all the responsibility to implement the program. That approach is low cost, but high impact and easy to implement because the local organization know about the nitty-gritty and the complexity of the issues.
Well, thank you both. I think the generosity of your thinking has come through in this. This has been such a rich discussion. There's so much to learn from each of you, and I really hope you'll get a chance to go deeper with some of your partners. But inherently, thank you for helping us understand what are winning coalitions, why they're about a village. It takes that to make things work, and how it's about, what you said, Lisha, reinforcing and finding your tribe, and Asif, love the line, scale the mission, not the organization. So thank you very much to both of you. Thank you to our audience. I really appreciate this opportunity to have this conversation. Thank you.